Hello, my name is Jen Griswold, and this is the oral presentation to an attending on a pediatric patient. Patient is an 8-year-old white female presenting to the clinic for follow-up on anxiety. She is currently being treated with Zoloft at 50 milligrams. Her history of present illness: mom and patient SG present to the clinic for a refill of Zoloft and to establish with a new provider in the clinic. Mom feels like things are going well with her overall. There's been an issue with the patient lying about taking her Zoloft at night because, quote, "I don't want to take any pills." It was previously discussed making it special for the patient and having a special drink she takes the medication with at night. Mom has not done this. When discussing not taking it with the patient and maybe having a special drink, the patient seems interested in that idea. Patient has had a fun summer, going to grandparents' home in Idaho, fishing, kayaking, and swimming. She's also gotten a new pet, a cat, that she is responsible for taking care of. Mom says that she's doing a good job taking care of it. She has adjusted to not playing with friends due to COVID, but she does go to daycare full time. They're operating at a limited capacity. Mom and dad work full time. She has been less aggressive to parents and siblings overall since the last time she met with the provider in the clinic 3 months ago. Parents have been working with a therapist on helping curb her moods before she becomes aggressive and upset. Some of these skills or techniques they've been going over is when the patient starts to get amped up or starting to seem like she's getting aggressive, they just praise her and tell her, "I'm so proud of you for not hitting anybody because you could have gotten really mad and you're doing so great," and lots of labeled praises during the day. And mom says they're doing it at least 5 to 10 times a day when she's at home, and this has really just squashed the aggression and helped it not get out of hand. Her past psychiatric history: she spent 5 months at a developmental preschool for OCD, explosive aggression, and she's been in therapy for the last 2 years. What caused the 5 months at a developmental preschool was that she was urinating all over the house, on furniture on purpose, after she was toilet trained, on curtains. She also spent a period of time of at least 3 months where she refused to swallow spit and was spitting on a washcloth. She also was obsessed with a Dollar Tree catalog for Halloween that she slept with every night for close to a year. Mom and dad taped it up as it tore, but needed it to go anywhere to sleep, and they eventually obviously got her off of it, and that was also when she was about 4 or 5. Her past medical history is unremarkable. Her developmental history: she met milestones on time and there was a normal pregnancy with mom. Social history: she lives with mom, dad, older sister, younger sister, maternal uncle, 2 dogs, and 1 cat. So a full house. Family history: mom has ADD, depression, anxiety. Older sister has autism, she's 10. Younger sister has ADHD, she's 6. Paternal uncle, bipolar, several attempted suicides, and multiple stays in the state hospital. Other paternal uncle has autism. Medical history is not significant. There have been no recent labs. Her blood pressure today, 92/60. Her pulse, 92. Her O2 on room air 98%, her weight 71 pounds, and her height 52 inches. Her mental status exam, her appearance, she's well groomed, she's wearing a t-shirt and shorts, orientation ×4, her attention, able to finish thoughts, memory intact, language appropriate, and her judgment appropriate for developmental stage. For her assessment, patient continues to have worries such as natural disasters and being separated from family. A lot of anxiety comes from having to go to daycare, so parents try to pick her up and her siblings close to 3 every day. They also keep them home at least one day a week during the week, and they also take them to lunch and get ice cream cones as a reward for having a good week. So she continues to have general anxiety. Plan of care, patient appears to be functioning better than she previously had been when she started on Zoloft. We'll have her continue Zoloft in conjunction with therapy, which she had been going once a month, but encouraged her to do at least bi-monthly, if not weekly. She seems to have a good relationship with her therapist, and the parents do as well. She does well when she is at school during the school year. Little issues, but has a history of, quote, exploding when she comes home. Mom feels like she does best when she's at home and tends to be more introverted. Continue to support family follow-up in 3 months and continue Zoloft 50 milligrams. So some questions for the attending. What makes this patient difficult? This patient appears to be attention seeking during the visit, making faces, sticking her tongue out, refusing to answer some questions, needing to be prompted again by mom. So just wondering, do you mostly ignore this behavior or do you address it? And also, would you increase the Zoloft if she needs something extra, or would you add something else? And if you added something else, what exactly would you add? And that's it.